Alrighty. So, hello. We are going to be talking about substance related and disorders. This is going to probably be around the 30-minute mark. So, get comfy. Um, that's it. Just get comfy. I do have a lot to say about this topic. I am pretty passionate about it, but will try not to bore you with all of my passions. Okay, so review the learning objectives. Before this, obviously they're found in ATI. So make sure that you review this. And then, kind of like a standard for studying is if you take the learning objectives, out on a piece of paper or Word document or whatever, and can you answer all of the learning objectives without looking back? And I think that is a kind of like a really good understanding of, did you get the information? Do you understand it? Okay. So for some quick stats, I love me a good stat. Or statistic. Substance related and non substance related addiction disorders affect people from all walks of life. Somebody can be a billionaire and deal with substance related disorders or addiction disorders that are non substance related, and somebody who lives below the poverty level can also deal with these things. It affects everybody. In 2020, approximately 14.8 million people had a substance use disorder, and illicit or illegal drug use and prescription drug abuse were acknowledged by 53 million Americans. If alcohol and tobacco are included, 165 million people currently abuse substances. In 2019, 7.9% of 8th graders, 18.4% of 9th graders, and 29.3% of 12th graders were reported getting drunk in the previous month. This is wild to me, okay? Especially since I have a rising 8th grader, so there's that. Mental health plays a significant role in substance use disorder, with the evidence of co-occurring disorders in many clients that have addiction disorders. This includes depressive episodes, suicidal thoughts, and other mental illnesses such as bipolar disorder, personality disorders, schizophrenia, so on and so forth. Anxiety disorders. Whether you're working in a PACU, in surgery, in the ICU, or run-of-the-mill, med-surg unit, outpatient, ambulatory care setting, you will experience a patient and have to help care for a patient that has a substance use disorder. So what are substances? Substances can include alcohol, legal medications, and illegal drugs. It can also include nicotine as well. And then we talk about non-substances, addiction disorders. This is like, a gambling addiction, shopping addiction. Those are like non-substance addictions. Okay. Okay, so when we talk about addiction, what is addiction? Okay, so addiction is defined as a state of both physical and physiological dependence, which include cravings and uncontrollable urges to engage in compulsive behaviors, even if there are harmful consequences. So I know that if I have this $1,000 and I have to pay my mortgage with this $1,000, I won't become homeless. But I really, really want this drug. I'm going to get the drug because that reward system in my brain is higher than me having stable housing. Okay. In a substance use disorder, substance abuse is seen when an individual is unable to abstain from the substance, continues to use the substance even though there are negative consequences, and experiences withdrawal symptoms when they quit the substance. So a lot of times, substance use disorder, I think is one of the it's different than the other mental health use disorders, because substance use disorder can have a direct negative impact on the other people that are around the person. So if somebody has, a addiction to crack, or maybe an addiction to cocaine, and then they now have an addiction to crack because they can't afford cocaine anymore, that addiction is going to supersede everything. It's going to supersede my job. It's going to supersede work. It's going to supersede needing, spending time with family, showing up for events. It's going to supersede everything. And the only drive to do anything is to get the drug. Okay, and because this is this reward system, which we'll talk about the patho a little bit later. So even when there is negative consequences, the individual is unable to abstain. Okay, and the DSM has different severity levels: mild, moderate, severe. You can look at this on your own. I'm not going to test you on it. I will test you on a couple of other things, but not this part right here. Now, categories and manifestations of substance use disorder. Okay, so impaired control, though there is a desire to cut down or regulate, the client is unable to do so. Okay, so my cousin just had a baby, and my aunt smokes cigarettes, and she doesn't want to be around the baby because she smells like smoke. So I said, well, my cousin lives only like 5 minutes away from my aunt. So I says, well, Auntie Dolina, why can't you just not smoke the cigarette? Like, take a shower and then not smoke from the time it takes you to leave your apartment to go to his house. And she cannot go outside and take a walk for 5 minutes without smoking her cigarette. So she is unable to regulate or cut down to do something that she wants to do. The reward is bigger than the negative of not being able to see her grandson. Okay. And so social problems, reoccurring use of the substance has resulted in a disruption in relationship at work, home, or school. So her cigarette smoking has resulted in, now my cousin is upset because he doesn't understand that she just can't stop smoking a cigarette when she goes outside. Like, why can't you just do that? It's his thought process. Risky use, a reoccurring use of substance, even when situations are hazardous to self or others. She doesn't have this, but this would be, HIV, other infections occur when people use dirty needles when they're shooting drugs, and people still do them, and people still share needles, and people still do these things. And, this is really risky and it could kill you, but people still do it. Okay. And then the physical dependence, exhibiting tolerance or requiring an increased amount of the substance to achieve the physiological effect and or after the prolonged use and experience withdrawal, which is when there is a decline of the substance in the patient's body. So those are, the manifestations of somebody who has substance use disorder. It doesn't matter if it's, a hallucinogen or alcohol or nicotine or, stimulant like cocaine or heroin, any of those things, or, opioid, any of these, they're gonna meet these manifestations. When we talk about when does addiction occur, so addiction can occur at any point in an individual's life. However, teens are at higher risk due to their developing brains. Decision-making, judgment, and self-control are not fully mature in teens. And so the addictive behaviors may result in poor grades, dropping out of school, and then when they become adult, then they may have social skills suffer, memory lapses, and concentration may decrease. Patients may also have difficulty with relationships, and if they have parent or children, they may have childhood neglect, or they may neglect their children, deal with abuse and other things. This right here is going to talk about neonatal abstinence syndrome. I'm not going to test you on that. I don't believe ATI is either, but if you do want to read about it, yeah, I think that you should. So I'm just going to talk a little bit about the patho. I'm not going to go into it too much because we do have a lot to cover. But when we just talk about the reward pathway, this is working strictly on dopamine, okay? So dopamine is the neurotransmitter that is affected when someone uses a substance. So when somebody uses a substance, they have an overwhelming amount of dopamine in the system. The dopamine release reinforces feelings of euphoria and pleasure with the used substance. As the substance persists, dopamine levels become very, very, very high, okay? Which then correlates to the risk outweigh the benefits, okay? And then over time, the euphoric feeling becomes overwhelming, and then the client believes that the only way they can achieve this is to increase their use of substances. This is also called tolerance. As the system becomes overwhelmed with dopamine, the system is then like, I don't need to produce any more dopamine. We got it from this substance. So then the body starts to not produce dopamine anymore. There becomes a decrease in dopamine. And with the decrease in dopamine, the person is now getting that reward just from taking the substance. And so, the prefrontal cortex becomes imbalanced, and then this creates a compulsive need for the substance. And then this is going to be affecting the ability to think, make decisions, problem solve, all because of the substance. Okay, so that's kind of like our patho. I will try to find a really good patho for addiction and substance use on YouTube. There's a couple that I really, really like. I just want to make sure that they're not overwhelming with the pathophysiology. Okay. All right, so we've already kind of talked about protective factors and risk factors. Protective factors are essentially going to prevent addiction, and then risk factors are going to play a role in the increased risk for someone having an addiction. Genetics also accounts for the increased risk for addiction. So developing an addiction genetics accounts for 40 to 60% of clients. Patients that are male, indigenous people, and white individuals are also more likely to develop addiction compared to other groups. Okay. So this just talks about, risk factors again. You can go ahead and look at this on your own. And we'll talk about Wernicke's-Korsakoff in a little bit. These are just this, excuse me. This right here is just the routes of use and adverse effects from common substances. So please make sure that you review this chart. We in this class are really only going to be talking about alcohol, benzodiazepines, cocaine, hallucinogens, heroin, and opioids. That's pretty much it. And then when we talk about opioids, we're only really talking about fentanyl, methadone, morphine, oxycodone, and that's it. We're not going to be talking about ketamine or cat or LSD, any of these. Okay, and we will talk about cannabis, but really not a whole ton. But please make sure that you review this as it relates to those. Make sure you know how they're used and the adverse effects of them. It's a really long list. Also, these right here are addictive behaviors. So as we talked about gambling, which is recognized in the DSM, but we also have compulsive sex disorders, food, internet use, social media, so on and so forth. Okay, so things that you need to know. I have all of this highlighted here. You need to know all of this information. And so this is the substance. the symptoms of use, concerns when under the influence, and withdrawal symptoms. You're going to have to be able to know if a patient is taking alcohol or using alcohol. How do I know that the patient is in withdrawals? Well, it's right here. Okay, so we talk about alcohol. Symptoms of withdrawal include agitation, anxiety, sweating, insomnia, delirium, so on and so forth. And delirium tremens is the very last thing that can happen that can cause the patient that is just really, really bad. Sorry, I just lost my train of thought. We talk about opioids. Patients, when they are withdrawing, they can have restlessness, muscle and bone pain, insomnia, diarrhea, vomiting, goosebumps. They can also deal with yawning and like runny nose. And then stimulants can also cause depression, tiredness. And so please make sure that you review this. And we're not going to go over this right here. Warning signs. So symptoms and warning signs of substance use disorder. So early intervention is key to improving outcomes given to the progressive nature of substance use disorders. So we talk about what are some early warning signs that somebody is using substances. Well, they may have some mood changes. They may have a decline in performance at school. They may have changes in their eating. Maybe it's increased eating or decreased eating, decreased weight gain, maybe some insomnia, change in peer group. Maybe they used to hang out with like the overachievers and now they hang out with, the kids that are constantly getting in trouble. Inability to be present in personal interactions. So this is the kid that just kind of like lives in their room and they don't come out. And then loss of money or valuables. So oh my God, I had a friend who the husband like had all the finances or something and the paychecks were gone after like a week and like no bills were paid. And she's like, where'd all your paychecks go? And he's like, I bought a ton of suits. And she's like, what? And it was just like very odd. I think she found out that he was going to like a strip club and like spending all of his paycheck in a strip club every 2 weeks and wasn't paying any of the bills and it was kind of wild. But that's, randomly loss of money or valuables. Anyways. Okay. So ATA stresses about alcohol withdrawal. We'll talk about this a little bit. And we'll also talk about it, in class. So you must know symptoms for alcohol withdrawal typically occur 4 to 6 hours after the last drink. Okay. Occasionally they may not develop after several days, but typically 4 to 6 hours after the last drink. Okay. Initial symptoms are going to include coarse hand tremors, diaphoresis, increased heart rate, vomiting, eye twitching, irritability. And then we want to prevent this, but progression may include seizure activity, hallucinations, and illusions. Okay. Few people will develop alcohol withdrawal delirium, but it can happen and we don't want that to happen. Things that you must know. You must know the stages of alcohol withdrawals. Okay. Now, you and I both have ATI. You see what I have highlighted. Go ahead and just take a picture. This is what you need to know as it relates to the stages of alcohol withdrawals. Okay. Now, who in the interprofessional team can help? The resources for, patients, we've got case management can help. Case management can help, but we can also seek out health counselors, psychologists, and social workers, as well as nurse practitioner, and physicians. You don't really need to know much about laboratory testing and diagnostics. And then what is the nurse's role? So the biggest thing for nursing is that we need to remain compassionate and non-judgmental. I think this is going to be like the statement of the semester: compassionate and non-judgmental. Okay. It's important that you understand, understand addiction, so that you can be compassionate and non-judgmental. It is important that we do talk about prevention, especially in children and teens. And it is, important that for patients that do have alcohol use disorder, that we prevent Wernicke-Korsakoff syndrome, also known as Wernicke's encephalopathy. So this is a condition that causes memory deficits, and thiamine is given. If a client who has withdrawal-induced anxiety is not relieved with benzos, alpha-2 adrenergic agonists, such as clonidine, clonidine might be considered. That is alpha-2. Anyways, they needed a comma. Anyways, in addition, if the patient has tachycardia and hypertension, they can also take a beta blocker. And then patients are also going to be given thiamine, because thiamine is going to help prevent Wernicke's-Korsakoff encephalopathy, which is essentially the patient is going to when we talk about Wernicke-Korsakoff, the patient. So when we talk about, for Wernicke-Korsakoff, when we talk about thiamine, the thiamine is needed for glucose metabolism, and it promotes functioning of the Krebs cycle, which you guys learned about in AMP1. I'm not going to review that. When we talk about alcoholism, chronic alcohol use disorder, the patient has a decrease in absorbing thiamine. And so if they have a decrease in absorbing thiamine, the patient is going to develop a neurological disorder called Wernicke-Korsakoff syndrome, which is life-threatening, but can be reversible with treatment. Chronically, it becomes Korsakoff psychosis, which is often irreversible, and it can be marked by like severe memory loss. Okay, so that's, you didn't ask for that, so I'm sorry. All right, long-term treatment for alcohol use disorder includes naltrexone and acamprosate. These medications can help with abstinence, as well as topiramate and gabapentin. Additionally, patients need to participate in cognitive behavioral therapy, 12-step facilitation, motivational enhancement therapy, community-based peer support groups such as AA. Okay, there's numerous amounts of resources, and so as nursing, you should make sure that you're aware of all the resources to give to your patients when you have patients that have alcohol use disorder or any other substance use disorders. Okay, so relapse and relapse prevention. It's important to note that relapse is a part of the journey. Okay, so when patients are trying to be substance free, this is a journey. Okay, and relapse is part of the journey. Okay, a lot of people see relapse as a lot of patients with substance use disorders and their families see relapse as a failure. It's very, very important to understand that it's not a failure. Instead, relapse should be considered an opportunity to begin on your sobriety journey again. Okay? We are not perfect. We are all I used to tell my patients, I am like one decision away from, making one bad mood or one stressor or one bad day away from, making a bad decision or making a decision that's going to affect the rest of my life. We are humans, okay? And so we need to make sure that we understand that relapse is part of the process. But evidence does say that the longer that every time somebody goes into relapse and they get back on their sobriety journey, their next time that they're sober is going to be longer. Okay, so relapses should occur less and less as time goes on. When we're talking about assessments, we do need to make sure, and we talked about this a little bit in pharmacology for those that took pharmacology, but we talk about the Clinical Institute Withdrawal Assessment Alcohol Scale Revised. This is a tool to assess the severity of alcohol withdrawals, okay? This is also known as a CWA. So the CWA score should be below 8 that indicates there's no medication. Any higher scores, 8 or over, there needs to be an initiation of benzodiazepines or other medications to help with symptoms, okay? So ATI, mild, a CWAS score is going to be a 10, moderate, 10 to 18, severe, greater than 19, and complicated, greater than 19. And here are the descriptions. Do you need to know this? Yes, you do. Oops. Let me highlight this. Okay. There are a couple of other assessments that nursing can do to evaluate for substance use disorder. So this is the CAGE. One score may indicate a problem with alcohol, okay? Or a score of 1. These are some of the questions that they may ask on the CAGE. Have you ever felt like you should cut down on your drinking? People ever annoyed you or criticized you, felt bad or guilty about your drinking? Have you ever had the first drink first thing in the morning to steady your nerves or get rid of a hangover? Eye opener. And then the audit score is another assessment, is another alcohol assessment screening, as well as the MAST. You have the CAGE questionnaires here. You have the audit questionnaire is right here. So if you wanted to look at it, and then you have the Michigan alcohol screening test. This is also right here. Oops, I clicked the wrong one. If you did want to look at this as well. Okay, so you can look at that on your own accord. You will need to know what these things are and why they're given, but that's pretty much it for that. Excuse me. There are different treatment settings that patients can seek when they do have substance abuse. So patients can do detox centers, inpatient treatment, medication assistant treatment. This is MAT. This is typically for opioid. My understanding from opioid, standard outpatient treatment, intensive outpatient programs, or IOP, or partial hospitalization programs, also known as day treatment. These are called PHP, and then there are also residential programs. It is important that you understand the difference between outpatient versus partial hospitalization versus inpatient versus residential. So please make sure that you do review these just to know that, the small differences between each of these, okay? When we talk about outpatient, this is outside. Intensive, outside the home, several hours per week for several weeks, okay? Typically, patients are not spending the night. Partial hospitalization program. The program is carried out during the day with clients going at home at night. Usually attendance is 20 hours per week. Medically supervised, okay? We have inpatient. This is somebody staying in a hospital setting. This is like a detox center, detoxification. And residential treatment includes 24-hour supervision. It is lower level supervision than inpatient treatment, and this can last, a few days to a couple of months. And then make sure that you just are just aware of what this 12-step program is, Alcohol Anonymous, so on and so forth. All right. So last but not least, this is just talking about the nursing process. How are we applying the nursing process to what we talked about today, as well as some of the other implementation or actions or interventions for some of the other substance uses. So we have nicotine, opioid sedatives, alcohol. Obviously, we've been talking about this whole time, but please make sure that you review that. And I think that is it. This is just talking about drug diversion. We don't need to talk about any of this. And I don't think that I discussed any of this back here. Okay, well, that's it. I hope that you learned a lot. Do not forget to make sure that you are applying what you learned. And how do you do that? This is dynamic quizzing. This is, do your engage test right after this. Did you learn something? And that's it. All right. Sorry that took the whole 30 minutes, but you know what? It is what it is. I hope you learned. All right, that's it. Bye, guys.